Welcome to Blackwood Vascular, a YouTube channel where I educate patients in real layman's terms about normal things that a vascular surgeon sees every day. I'm hoping to just simply make things very simple for people to understand, showing you guys pictures of things that we go through every day as vascular surgeons. And if you like these videos, remember this is all medical education. There's no advice here. If you want advice, go see your own doctor. But like and subscribe and follow along if you like these videos. And if you have a question or email me at blackwoodvascular@gmail.com and I can make a video for you. Today we're talking about something most patients who have vein disease don't even think about. They've not been taught this stuff. And even sometimes after their 4th, 5th, 6th, 7th vein procedure, these systems, what I consider to be scoring systems that we use to measure how bad your disease is in terms of chronic venous insufficiency or varicose veins, they've never been taught these things. And so they just keep going for procedures, not sure where they lay on the scale of severity in terms of really, really bad or not too bad at all. Do you really need another procedure? Or should I just ignore this next procedure and wait it out? So think of these scores that I'm going to be talking about over the next few weeks as staging systems, like how you would stage lung cancer, or class systems. Like if you look at heart failure, people would say some people, they can't really, they have a very bad level of heart failure and they can barely breathe, etc. It gives you like a kind of like a structure of how bad your disease is. They give you some like a clearer picture, you know? And that way you can understand whether your disease is getting better or staying the same, or you're being completely treated in the wrong algorithm completely for what you actually want or desire. The two that I use, that I have been trained on extensively and that I use every day, are number one, the CEAP classification, CEAP, and I'll put that up here somewhere on the slides. And it describes your vein disease in 4 parts. What caused the vein disease, where in your blood vessels is a vein disease, and the pathophysiology, meaning like, is it due to a DVT or is it due to a mostly reflux problem, etc. The classes run basically from C0, CEAP, C0, meaning like there's nothing at all, you're perfectly healthy, and you have no varicose vein disease or venous insufficiency, all the way to C6. C6 is the worst case scenario, where a person actually right now watching this video has an ulcer on their leg that is not healing. And we'll talk about the CEAP in more detail later. It doesn't tell us how your treatments are going and what it's improving. It's more of the initial snapshot that we get when you walk into the clinic and we see you for the first time. We want to know how bad you were. You're a C3 patient or you're a C2 patient with pain or swelling, edema, etc. Or do you have skin changes and you're a level 4, or you're at C number 5 where you have an ulcer that has healed, or are you ultimately the worst case scenario where you have an active ulcer? So we'll talk about that more, and I'll put up a picture here of the actual table so you can just look at it and pause the screen. Then the other one, which I use all the time, is the VCSS. This is called the Venous Clinical Severity Score. I think this is a little bit more objective than the CEAP system because it actually gives me more data to work with. But it is very heavily weighted, I think, on whether the patient has an ulcer or not. And because the ulcer scores are really, you get points for grading of the size of the ulcer. You get points for, a lot of stuff around ulcers. So your VCSS score can rise a lot if you have ulcers and skin changes. So it's really better for like the more advanced levels of the CEAP classification. But I like the VCSS because if you've treated a patient with 3 procedures to heal an ulcer, and they come back 3 years later and you look at their VCSS score and it's gone from a 12 to a 7 or a 6, then you're doing good. You're on the right path. And if you're a patient who walk in with a VCSS score of 4 or 5, and your physician then offers you 7 different procedures, maybe we should think about that for a little bit. Do we really need those procedures? If you guys found this video helpful, you subscribe to the channel. It's 100% free. It's all educational. It's all me, real. And for personal recommendations and actually medical care, go see your own doctor. Thank you very much, guys, and good luck on your journey.